Hey everyone, it's Dr. Hodges and I am just taking Pippi out for our little walk today. It feels really good, but I think it might rain in just a bit. It just kind of has that weird damp kind of feeling. Let's see how the Pipster's doing. Hey, how are you? She's looking all around. All right, so I'm going to do two separate videos. One is how to prep for a successful surgery, and then I want to have another video how to be successful right after surgery. So one of the things, what I really want to focus on today is pre-surgery and everything that you can do to make sure that you are going to have the best possible outcome while you're in the hospital, and what you can do to make sure that you kind of have all your ducks in a row. First and foremost, it's really important that you get a couple of things taken care of. I know we always have at our preoperative appointment, we give you your medications. Now, some doctors don't do this. Some doctors will give you your post-op meds like while you're in the hospital for you to go buy and pick up. We have learned that these pharmacies, they're like, oh, that's on back order. Oh, we don't have that. And generally I do a pre-op visit 1 to 2 weeks before somebody's surgery. And I've learned to give my patients their post-op meds at that time. That way they have 2 full weeks, or at least 1 full week, to get those medicines in case the pharmacy has to call out for them. So these are Charlotte's helpful hints for making sure everything goes smoothly with your meds. First and foremost, please make sure that you contact your doctor's office and you give them an updated pharmacy. There are a million CVS's. I'm here in Dallas. There are some streets that are so long that have 4 or 5 CVS on them, okay? And I will have some patients that will call in and they're like, oh, I want to go to Caremark. Oh, I want to go to CVS. Oh, I want to go here. And then they call in a couple of days later. Oh, why did I go to CVS? I want to go to Walgreens. I'm like, okay, I didn't bring my crystal ball today. So if you want your medicines to go to a specific pharmacy, make sure, and that is your responsibility, you have got to call your clinic and make sure that you are telling them where you want your medications to go. Because it may have been, I know for us, whenever a patient comes in for their initial consult, they may write down their pharmacy, but maybe they wrote down their pharmacy that is right next to their house, but really the pharmacy they like to use is the one that's right next to their job. So, or maybe their insurance changes and now they have to use a mail order pharmacy. So, number one, if you want to make your post-op meds go smoothly, make sure that you update and you let the clinic know what pharmacy you want to use. Please do not just say, oh, you know what it is, it's on file, because it's inevitable. It is not the pharmacy that you want. So you need to confirm the pharmacy that you want your doctor's office to use. Number 2, I really like to use GoodRx. GoodRx is a fantastic cash service, sort of. So if you go to goodrx.com and you type in the name of a drug, they will send you a link, so they'll send you a text, email, and they will tell you, what the cash price is for any medication in your area. And then it will give you that cash price if you go to Walgreens, if you go to CVS, if you go to Costco. It'll do it, and they do it based on your zip code. And you can use it whether you have Medicare, whether you have private insurance. So at the time of my patient's pre-op visit, I will give them a sheet of, I send the medicines electronically, but I actually give them a list of their medications. And that way they have that list because they get several. They get pain medicine, nausea medicine, blood thinner, and an acid blocker. And I have the name of the medicines, and then that way they can look up those medicines on GoodRx and they can see what's cheaper. Is their copay with their insurance cheaper, or is it cheaper if they use GoodRx? And so they may find 2 of the drugs are cheaper with insurance, and the other ones are cheaper if they pay cash using GoodRx. You can certainly use that. So that's one other good little tip. Another tip that I have found is I do not call in scripts and I do not fax in scripts. I send everything electronically because I've had way too many times that the pharmacies say, we didn't get the message, or the fax failed. When you send it electronically, like it will tell me at, 2:37 p.m. and 27 seconds, the electronic submission went through, and it will say whether it was a success or if it was a failure. And so it really helps to put the onus on the pharmacies. I also send all of my prescriptions in block. And so if there's not really a chance for the pharmacy to say, well, we got 2 of the scripts, but not the other 3. They were all sent at the same time. So typically, if they are not there, it's because they're not in stock. It's not because they were not sent. So the last thing that I would recommend to you guys when it comes to your post-op meds, in order to be a success, is when you go to your pharmacy and you ask for your prescriptions, if they are not there, you need to ask them what didn't they fill and why didn't they fill it. Okay? And so I know for me, I have found that sometimes, even if insurance does not cover a medicine, even if the cash price is $10, a lot of times the pharmacies will not fill it. And just because you did not get a reminder text from CVS that your scripts aren't there, doesn't mean that it wasn't filled. I've had a handful of patients that will call and they just read my clinic, the Riot Act, and they're like, I didn't get my meds and blah, 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 blah. And my medical assistant will call the pharmacy and they're like, the meds are here. And then I will question the patients about it. I was like, what happened? They said that the meds are in. They're like, oh, I just didn't get the text. So before you call your doctor's office and gripe at them, why don't you just call the pharmacy and make sure it's actually there? Because you may not have just gotten a text. So your medicines might actually be there. So those are some little housekeeping tips just on the pharmacies. The other thing that I recommend is to help decrease bleeding. Now again, this is my disclaimer. This is not true medical advice. You need to check with your own physician to see what works for you. This is just general information. I am not treating patients right now. So take that for what it is. Always make sure that you have your exact plan with your doctor. However, I will tell you, there are certain medications that can make your blood thinner. And for the vast majority of patients, that is not a good thing prior to surgery. Check with your doctor, though, before stopping any medication or any supplement. But for my patients, generally, if you take vitamin E, if you take primrose oil, if you're doing NSAIDs don't really make your blood thinner. However, vitamin E, primrose oil, those flaxseed, those can make your blood a little bit thinner. And so I like patients to be off those types of supplements at least a week before surgery. As a general rule, if you are on aspirin, if you are on Plavix, if you are on any type of blood thinner, you certainly need to check with your surgeon and with your prescribing physician. A, can you come off of those? And B, if you can, do you need some bridging protocol? So certainly check with your surgeon and with your ordering physician of those medicines on how to deal with blood thinners that you may already be on, okay? The other thing I would recommend is go ahead and get all your vitamins. Of course, the vitamins that I really like, I like Bariatric Advantage. The 2 best ones I think are going to be a good all-in-one, because who wants to take a mitt full of vitamins whenever you have a teeny tiny little tummy? I would also recommend getting a chewable. You don't have to do a chewable. Just know that if you get a great big tablet, you're going to have to cut that thing up in little chunks. Otherwise, it might get stuck in your stomach. And so I really like Ultra Solo with iron. That's like 1 chewable once a day. I also really like the Advanced Multi-EA, and I'm going to have links to all these down at the bottom in the show notes. Both of those are all in one. It is your multivitamin, iron, B12, and vitamin D. So Ultra Solo 1 and the Advanced Multi-EA is 2. And actually, the Advanced Multi-EA, I used to really be a huge fan of the Ultra Solo. I mean, I still am, but I think that the Advanced Multi-EA might be a bit better because it has a little bit more in it, and that might be a better option for patients. You'll also need to get your calcium as well. In my practice, I generally don't have you guys start your calcium until week 3. So for the immediate post-operative period, at the very least, get a good all-in-one. There are a bazillion different vitamins that are on the market. Please don't get a liquid vitamin. They are not complete vitamins. If you were not having bariatric surgery, I'm sure it'd be a great vitamin for you. But I think that there's a vitamin on the market like Mrs. Ruth's or Auntie Ruth's or something like that. Anyway, that is not a complete vitamin. If you're having bariatric surgery, that is not a good option for you. I mean, even Centrum Adult Liquid, that's not even a complete vitamin. You're still going to have to supplement with lots of other vitamins. So I really think just getting a good quality bariatric vitamin is the way to go. It's going to be less expensive, and it's also going to be less that you're having to take on a regular basis. So you want to do well? That's what the purpose of this is. So get a good quality bariatric vitamin. I think the Ultra Solo is about 23 to 25 bucks for a 1 month supply, and the Advanced Multi-EA I think is 32 or 35, something like that. Let's see what else. Vitamins. Oh, get some protein, because I usually will have all my patients start their protein starting on that first week. Now, one of the things about post-op protein is that your sense of smell and sense of taste might be heightened after surgery. So even if there's a big old sale on at Costco, maybe don't buy 12 cases. You may just want to start off with 1 case. That's going to be plenty. I also really like Fairlife milk, because if you get sick of trying to suck down a protein drink, have a glass of Fairlife milk. 1 cup is 13 grams of protein. That is a great option. The other thing I would recommend is maybe try some different soups. So in my practice, I do clears week 1. So you can get low calorie juice, like low sugar. You can do broth. So the broth from chicken noodle soup, the broth from French onion soup, the broth from pho, salt, pepper, zhuzh it up. It's not going to hurt a thing. And then you can also get some thicker soups starting on week 2. That would be like cream of mushroom, cream of chicken, potato soup. Just know that it has to be blended. So if you can pick up just a couple of those, you do not have to pick up cases of this stuff, because you're not going to be doing a lot. I mean, I tell my patients, you might be doing half a cup to a cup of broth at each meal, and maybe 1 protein drink, and then maybe 1 or 2 bottles of water that first week. The biggest thing about that first week is just trying to stay hydrated. But if you can go ahead and get some of these things purchased, that will be the best. Also, make a, and I'm going to have one of these like little idea bags set out for y'all. When you're going to the hospital, bring some house shoes, bring a house coat. You may want to bring like a little lip mask, because sometimes patients, their lips get really dry. Bring your toothbrush, bring your toothpaste. We will have, I know for us, we have, we give all of our patients Gas-X drops. Typically, if you're going to the hospital, they're not going to allow you to bring other supplements and medications into the hospital with you, but you can at least have those whenever you get home. Let me see. Oh, and last but not least, whenever it comes to getting prepped the week before, so I know some doctors, they will have you on a modified diet a month before. That's kind of going by the wayside. Even like 2 weeks before, that's kind of going by the wayside. Most of my colleagues, including me, we have patients on liquids a week before. in the era of the GLP-1s, so that's going to be Wegovy, Zepbound, Ozempic, Mounjaro, semaglutide, tirzepatide. Those things can certainly cause your gut to slow. Hi there. And I know my anesthesia group, they generally want you off your GLP-1s a week before they have surgery. Every anesthesia group is going to be a little bit different with their recommendations. Some want you off 2 weeks before. I mean, I've even heard some people, they want you off at least a month. You are certainly at risk for having slowing of the gut if you've been on a GLP-1. And how does that impact your surgery? Well, if your gut is not emptying like it should, and you have a stomach full of goo and liquid, when we put you to sleep, all of that can come up and you can choke on that and you can aspirate that. You can get a pneumonia. I mean, worst case scenario, you could have lack of oxygen going to your brain. You can get an anoxic injury. Now that's pretty extreme, but it's really important that you talk with your doctor if you're on a GLP-1 as to when you need to stop those, because you certainly need to be off that for some time. I know, but like I said, it's going to be kind of talk with your anesthesia group, and I know that your surgeon will kind of already have that recommendation. But it's really, really important that you stay on your preoperative diet. Don't cheat. The reason why I say that is the purpose of the preoperative diet is it helps to shrink the size of your liver. If you have a great, big, thick, boggy liver and we're retracting up on it, there's a chance that we could cause injury to the liver. It could crack, and it could cause some significant bleeding if you have this great, big, thick liver, especially if you have a history of fatty liver. So you have to. You got to stay on that preoperative diet because we want to make the surgery as safe for you as possible. Don't cheat. You got to do that preoperative diet, okay? And then also talk with your surgeon if you are on a GLP-1. So when you're going through all your medications preoperatively, you got to look at those. So I think if you can make sure that you're kind of getting your vitamins and your protein all lined out, if you can make sure that you have your post-op meds squared away, and then finally making sure that you're compliant with your pre-op diet, those are going to be the best ways and the best things that you can do to make sure that you're a success while you're there in surgery. Okay? So best of luck, you guys.